Hello, in today's class we'll be discussing regarding pterygium, the staging of pterygium belt. Okay, so the staging will be based on morphological features, the extent, and also regarding recurrent pterygium. So the mechanism of recurrent pterygium, its grading, prevention and management. So let's start with what is pterygium. So pterygium is a benign, triangular, fibrovascular proliferation presenting as elevated, superficial, wing-shaped lesion extending from perilimbal bulbar conjunctiva onto the corneal surface. Right, so this is the definition of pterygium. So it is a triangular fibrovascular proliferation which presents as an elevated, superficial, wing-shaped lesion which extends from the perilimbal bulbar conjunctiva. So this is the bulbar conjunctiva. So on to the cornea. So it is a wing-shaped triangular proliferation. Right? So it is most commonly in the nasal side of bulbar conjunctiva because of more UV rays which are reflected from nose. So this is most commonly found in pterygium belt. So there is a pterygium belt by Cameron. So he says it is most commonly in tropical and equatorial countries. So right, so India also comes in this. So in the latitude 37 degrees north and south of equator. So the prevalence in India is almost 9.5 to 13%, and in the world it is ranges from 3 to 33%. Alright. So this is regarding the prevalence. Now coming to the etiology, as you have seen, one is the UV rays, and in some cases it is also being called as loss of limbal stem cells. So because of loss of limbal stem cell, these cells migrate from the conjunctiva onto the cornea, and also due to dust, and in some cases there is also herpes simplex and virus. And in the pathology, there is, as we said, degeneration all along with the hyperplasia of the conjunctiva. Okay, so the subconjunctival tissue, it undergoes degeneration as well as proliferation, right? So we have discussed earlier. So it is a fibrovascular proliferation along with degeneration. So the subconjunctival tissue undergoes blastotic degeneration and there is fibrovascular proliferation. So it encroaches upon the cornea, therefore the corneal layers, that is the epithelium, the Bowman's membrane and superficial stroma, these are destroyed or evolved. On immunohistochemistry, it is matrix metalloprotease positive. Signs and symptoms, there is watering, irritation, there is foreign body sensation and defective vision. So the defective vision is due to astigmatism. We have to remember this. So this astigmatism is more common, as we know. The vertical meridian is more curved than the horizontal meridian, but whereas because of this encroachment, the horizontal meridian here becomes more curved, right? So it becomes the against the rule astigmatism. And the second cause is due to when it encroaches pupillary area. So the visual axis is obstructed. And the third cause is due to ocular muscles restriction. So the medial vectors. So it is most commonly present in the nasal side, as we discussed, and when it is present on both the sides, both nasal and temporal, it is called as double pterygium. The parts of pterygium. So as we have discussed, this is the head, this is the neck, and this is the body of pterygium, and this is cap. So head is the apical part of the pterygium, neck is the constricted part which is present over the limbal area, and body is the scleral part, and cap is the infiltrate the cornea, which is present just in front of the head. Coming to the types of pterygium. So one is progressive and another is regressive. So progressive is thick, fleshy, vascular, whereas regressive one is thin, atrophic, avascular or very little vascularity. So in the progressive pterygium, there can be whitish infiltrates in the cornea. So it is called the cap of the pterygium. So this is present in progressive pterygium. So these are called as, these infiltrates are called as spots or islets of gold. Whereas in the regressive pterygium, iron deposition anterior to the head. So this iron deposition is called as Stocker's line. Coming to the staging. Staging can be morphological, so morphological T1 is based on its morphology. It is atrophic and transparent, form with clearly visible episcleral vessels. So type 2 is intermediate, form with partially visible episcleral vessels, and type 3 is fleshy and opaque, form with totally obscured episcleral vessels. So type 1 is regressive, whereas type 2 and 3 are progressive. Now based on the extent, so if the pterygium is crossing the limbus, you see it's stage 1. So if it is midway, it is stage 2, and if it is crossing the pupillary margin, it is stage 3. So here we have this pupil, it is stage 3. So 1 is limbus, 2 is midway, and 3 is the pupillary margin. So these are three types based on the extent. So we will discuss regarding recurrent pterygium. Okay, so recurrent pterygium most common complication of a pterygium surgery is its recurrence, right? So we will discuss a little bit regarding this before going into the management part. So recurrent pterygium is characterized by increased underlying fibrotic changes, along with ocular movement restriction, in cases where the medial rectus muscle has been damaged by recurrent surgeries. Okay, so the mechanism of this recurrent pterygium is that there is reactivation of inflammatory processes. So there is compromised conjunctival epithelial integrity at the excised area, because of which there is vigorous fibrovascular proliferation. So this proliferation is due to activation of limbal stem cells and fibrovascular tissue, which is due to increased upregulation of vascular endothelial growth factors and cytokines, which in turn causes increase in the matrix metalloproteases, which destroys Bowman's membrane and stromal collagen. Right, so this is the mechanism. So here the epithelial integrity is already lost due to excision in the previous surgery. Therefore, the proliferation in this recurrent pterygium is very severe compared to the primary pterygiums. Now coming to the grading of this recurrent pterygium. So grade 1 is normal appearance. Grade 2 is there is fine episcleral vessels plus no fibrous tissue. Stage 3 is fibrovascular tissue reaching the limbus, and grade 4 is this fibrovascular tissue invading the cornea. So this is the grading of recurrent pterygium. Okay, in the next class we'll discuss regarding the management, surgical management. So how do we prevent this? So by the use of protective sunglasses, so there should be UV protection in it, and with the use of wide brimmed hats. So these are some protective measures, and the supportive treatment is with the help of lubricants, topical steroids, we get to give refractive correction because there is astigmatism, and in higher grades we need to go for surgery, which we'll discuss in the next class.